So I guess I'll start with a fun fact, which is I love donuts. Okay, I am wearing donut socks, and I am known as St. Louis, Missouri's donut connoisseur. And I did a story for St. Louis Public Radio, and I was voted most fun story of the year in 2016. So I promised I'd actually get to my project at some point, not talk about donuts for 4 minutes. So I'll try. My name's Andwele. I'm a USA fellow from St. Louis, Missouri. And when folks see my name, the first thing they say, "Where are you from?" And I say, "I'm from Birmingham, Alabama." And that doesn't quite make sense because it doesn't. My mom's from Jamaica. There we go. And my dad's from the Commonwealth of Dominica, so both from the Caribbean. I was born in the United States in Baton Rouge, Louisiana. But to complicate things further, I spent early childhood in Senegal and in Mali, but grew up a little bit everywhere in the United States on the East Coast and in the South. So that sort of like set the stage for the fact of why I'm so confusing. And both my parents happen to be professors as well, so I was tortured as a child. My mom being an epidemiologist, my dad being an economist, and together they made a physical therapist. So I'm a physical therapist by trade, and I love studying movement and helping people live high functional quality of life. And it doesn't quite mesh, again, with the donuts, but I run for donuts. And so as a physical therapist, one of the things that puzzled me was the fracture or the disjointedness of our healthcare system, that providers don't really communicate well with one another, and that leaves patients without understanding how to organize or access healthcare. And so that led me to think about, well, how do I fix it? And so I decided to move into healthcare management. So now I run physician practices for the Washington University School of Medicine. And I work on trying to figure out how to create interdisciplinary and interprofessional care models to help disease-based management for patients. In part because, in part, it's important to understand that, how healthcare policy, regulatory environment either incentivizes or decentivizes providers to help communicate in order to come up with a care plan that meets your needs. And so that led me to the Eisenhower Fellowship, where hopefully I'll be traveling to Australia and Rwanda to look at how do they utilize their resources differently to meet the global healthcare workforce shortage demand. Right now, it's about 8 to 10 million shortage of providers out there. It's about to be about 15 to 20 million, depending on what literature you look at. That means that we're going to be aging, like the gentleman said before, and we're going to be living longer with chronic diseases. And we're not going to have folks that take care of us. So how do we do this more efficiently? How do we do this more collaboratively to make sure that we come up with care models that allow us to treat as many folks as we can in underserved, in rural and in urban populations? And Australia is one of those countries where they're growing their provider base at a rapid rate compared to the U.S. So I want to look at that and evaluate that. And in Rwanda, because the provider shortage is so great, they're doing a lot more task shifting, allowing other healthcare professionals to extend care into rural areas and having great results with their HIV/AIDS infection rate and also with their infant mortality. And so my goal is to go overseas into Rwanda and Australia to figure out how can we leverage what they've done there in order to make sure we are able to extend care, work collaboratively as providers to make sure that patients get the needs that they have. Let's see, I think that summarizes. So I ended with So I'll give you one more fun fact. Is that okay?
Since I gave away yours.
Oh my goodness, I have to come up with another one. So I have two beautiful kids. Both of them are preemies. My son was 2 pounds 12 ounces at birth, and my daughter was 3 pounds and 12 ounces. Both are doing exceptionally well, and they run me very tired on a regular basis. Thank you.